Hi, everyone. It's Scott Faber with EWG. Thanks for joining us. I'm so thrilled to introduce Leah Douglas, an associate editor and staff writer for the Food and Environment Reporting Network. As many of you know, Leah has been very closely tracking the number of food and farm workers who have gotten sick or even died from exposure to COVID-19. Prior to joining FERN, Leah was a reporter and policy analyst with the Open Markets Institute, where she researched economic consolidation and monopolization in the food and agriculture industry. And she founded and wrote Food and Power, a first of its kind resource on food sector consolidation. After a short presentation, we'd love to take your questions. If you have questions, please post them in the comment section on your Facebook page, and we'll be sure to ask Leah. So happy to turn it over to Leah. Take it away.
Great, thanks so much, Scott. Hi, everyone. So I'm just going to walk through a few slides that show some graphics related to the work I've been doing, mapping COVID-19 cases among food system workers, and that includes meatpacking workers, food processing workers, and farm workers. I've been tracking and counting outbreaks of COVID-19 at food system facilities since April. So if the person running slides could pull them up. Amazing, thank you. Great, and this is just a picture of workers being screened before entering a Tyson facility. Next slide, please. Great, so I began this project in April, looking at the spread of COVID-19 among food system workers, which is really just beginning at this time. And there had been some news coming out that that the virus was spreading in these, especially meat facilities where workers are in quite close quarters. And there were sort of disparate news reports and not necessarily a central database. So I started pulling together this map. This is what it looked like the first day that I published the map in April. I think at this time there were maybe 40 outbreaks recorded and maybe 1,500 workers affected. So next slide, please. So this is what the map looks like today, or I guess as of yesterday. As you can see, there's been rapid spread of COVID-19 in these facilities. And there's a color coding here. So the green scale represents farms and ranches, so production facilities, greenhouses, things like that. And the purple scale is food processing facilities, which for my purpose includes everything from seafood facilities to frozen foods, next stage meat processing, sausage plants, things like that. So it's a big spectrum there. And then the red scale is meatpacking facilities, which are, for my purposes, mostly defined as sort of the first stage processing. So where the animal is slaughtered and the initial processing begins. You can see that there is a really high concentration of meatpacking outbreaks in the Midwest, and also in the Southeast, where there's a high concentration of poultry processing. There's also been a number of outbreaks in the Pacific Northwest related to the fruit industry out there. So there's a very high concentration. If you go online to look at the map, you can zoom in. There's dozens of outbreaks in very, in a relatively small geographic area. So those are regions where workers are traveling to a variety of farms and facilities that might be very close to each other. I often find when I'm plotting new outbreaks that sometimes they're right across the street from outbreaks that were already on the map. So we've seen that there's a strong clustering effect to how this virus is spread, just like we've seen in other sectors and other regions related to COVID-19. Next slide, please. So this is a trend graph just to give a sense for how the virus has spread over time in this sector. So this is a cumulative chart. So it essentially is showing cases going up over time. And this was as of June 22nd. So it's a couple weeks out of date now. And there actually was you can see a slight leveling at the very end for a couple of days. Since then, the cases have just skyrocketed again. So unfortunately, we're really not seeing a dramatic slowing in the number of cases among food system workers, and the number of outbreaks is also growing. I think as of today, I had counted outbreaks at almost 500 facilities across the country. Next slide, please. So this chart just breaks down a little more detail the proportion of cases represented by each of the sectors that I'm tracking. So you can see that meatpacking workers represent an enormous percentage of the whole. This is in part because, well, for a variety of reasons. One is that some of the facilities that have been affected by COVID employ very large numbers of people, so 3,000–4,000 workers. So when COVID gets into those facilities, the case numbers are very high. Whereas in the food processing sector, there are certainly some very large plants, but it's just a much more varied space, and some are also very small. So we've seen, I think, meatpacking workers as of this is also a couple of weeks behind. As of today, July 9th, there's around 35,000 meatpacking workers that have contracted COVID-19. And that represents the majority of the cases. Next slide, please. So I've done a couple of analyses breaking down these cases by employer. In the meatpacking space specifically, in the farm and food processing sectors, there's so many employers that it's hard to pull out specific trends. There haven't really been specific companies that have risen to the top in the same way that there have in the meatpacking sector. This is partially because the meatpacking sector is highly consolidated. So, 4 or 5 companies are hugely dominant in that sector. The same isn't exactly true in food processing or in farm and food production in the same way. So here we can see that Tyson Foods is clearly leading the pack here. And this is as of today, so I just updated these figures. Tyson represents over 9,500 of the meatpacking cases, which is about a third of the total number. So this is in part because Tyson is the largest meatpacker in the country. They own facilities that process poultry, beef, and pork, which is a common feature of many of these companies that process multiple types of meat, but Tyson really leads the pack. I saw a figure today that Tyson employs about 120,000 people in their meatpacking facilities. So this number represents maybe 8% of that, of its total workforce. So there has been a significant amount of activism and direct action targeted to Tyson, which we might talk about more in our discussion. It's really become the target of a lot of worker complaints that the facilities have not responded quickly enough to worker concerns about the spread of COVID, that the company was slow to introduce personal protective equipment, and has not taken other measures like installing physical barriers between workers or slowing down the processing line so that workers can space themselves out more appropriately. And just to talk a little more broadly about the meatpacking and COVID relationship, and some folks might have already heard about this, but the reason why meatpacking facilities are so particularly subject to the spread of COVID is in part because workers are so close together. In many parts of the facility, in the processing line, workers are shoulder to shoulder. In some cases, they have to shout to be heard over the equipment, which we know can contribute to the spread of COVID. The facilities can be quite cold and damp. So really, it's the perfect incubator for a virus like COVID-19. So that contributes to why meatpacking plants represent such a huge share of the cases. Next slide, please. So I've also broken down these cases by state to try to understand where we're seeing the spread most dramatically. This is also a couple of weeks behind. I think the number of states as of this week that where outbreaks have happened in food facilities is maybe 42. So we're talking virtually everywhere. There's a few states where that tends to overlap with just states where there haven't been a high number of COVID-19 cases in general, and Mountain West and so on. But virtually every state has had an outbreak of COVID-19 at some sort of food processing facility. And this chart demonstrates where outbreaks have happened across all 3 sectors that I'm tracking. So I thought that was helpful to just pull out, in some ways, this is just representative of states where there's a lot of food manufacturing, but it also helps to demonstrate where the virus is spreading dramatically and where also reporting is more consistent. So for instance, the state of Colorado is the only state in the country that is regularly releasing data about workplace COVID-19 outbreaks and has been doing so for several months. So the number of outbreaks in Colorado is very high for our data set. That doesn't necessarily mean Colorado is a bad actor in any way. It means that their reporting is more consistent. And if every state was doing that, these numbers would be substantially higher. So we can assume safely that all of these figures are undercounts, with the exception of states where there is rigorous reporting. And in this case, that refers only to Colorado. Next slide, please. Oh, that's the end of my slides. This is the same still as above. So I'm happy to take any questions.
Great, thanks, Leah. I know we've gotten already a number of questions about what CDC released yesterday and why those numbers are lower and how we should interpret those numbers and what was in the CDC findings that might be important to focus on. Can you help us with that?
Absolutely. So the CDC has released 2 reports on meatpacking workers specifically, and COVID-19 first was released on May 1st, and the second was released on July 7th. So the CDC's method for collecting the data is to survey state health departments, and health departments can opt in to releasing their information to CDC or not. In this most recent survey, 23 states reported outbreaks at food manufacturing facilities, among meatpacking workers specifically, to the CDC. So already that's one significant flaw with the data, is that we know that there's been outbreaks in more than 23 states. Also, that list of states excluded states like Iowa, Mississippi, Texas. Those are some of the biggest meatpacking states that we have in the country. So that's one of the reasons why the case count is significantly lower than the one I just presented. Another reason is that their data in this most recent report only tracked to May 31st. So there's about 5 weeks of data there that's unreported. I think as of May 31st, I had in my count maybe 4,000 more cases than CDC, so it wasn't so substantially off. Now, of course, my count has reached basically double what they reported yesterday. So I think that time lag is also contributing. Despite that, there are some significant findings in that report. Namely, what jumped out to me was that according to the state data, nearly 90% of the people, the workers who have contracted COVID-19 at meatpacking facilities are people of color. So, and that's broken down in their report into Hispanic people, Black people, and Asian people. That's just how they do the demographics. So that percentage was significantly higher than I had previously seen, just using industry demographics that said maybe 3/4 of the people at meatpacking facilities identify as people of color. So that higher percentage definitely stood out to me. They also collected data on which types of preventative measures plants were using. So were plants screening workers before they entered into the facility? Have they implemented testing? Have they implemented physical barriers between workers and so on? All of those numbers are lower than we'd want them to be, nowhere approaching 100% of adoption of those preventative measures. But that was some data that we haven't been able to distill just from news reports. So those are some helpful findings.
I guess one related question is, it sounds like that states are reporting some data to CDC that they're not sharing with the general public. You mentioned that Colorado is the only state that so far is really reporting outbreaks at all 3 sites where you might see outbreaks. Can you tell us a little bit more about why states you think would be more transparent are not sharing that data? Why are they sharing it with CDC but not with the public? I think folks would be curious about that.
Well, that's a great question, and certainly one that I wish it were different. As I said, Colorado is the only state that's been doing consistent reporting to the public of workplace outbreaks. The state of Oregon has also recently begun doing that, maybe just over the course of the month of June. And there's a couple of other specific localities where you can solicit data. They're willing to share it, but not necessarily publishing it daily. I think that's one of the elements of the CDC reporting that I find frustrating is, federal government has a unique ability to solicit and require reporting from states that no one else in the country has. No individual journalist or advocate or worker has that ability. And the fact that these surveys appear to be voluntary and states can choose not to participate is unfortunate. I can't say why the states themselves are choosing not to disclose data, but there has been some reporting to indicate that, for instance, in some states where the meatpacking industry is very powerful, that, the meatpacking industry lobby has petitioned elected officials not to disclose the number of cases at meatpacking facilities, supposedly in the interest of protecting the industry in some way. So of course, as a journalist, we would wish that information was all made public, but it has been inconsistent.
Something else you said is that the numbers just keep going up and up, that there just seem to be steadily increasing in May, June, now July. You've been reporting and others have reported on the fact that some meat packers, food processors, farms have adopted protections like PPE and some social distancing. So what does it tell you that that the numbers keep going up? Is it that those protections aren't actually being implemented? They're not being fully implemented. They're not effective. What do you take from that?
I think it's so difficult to generalize because, to be honest, the way this data is making its way to the public is very inconsistent. I think we have seen the virus move into new states since the beginning of the pandemic. Even just in the last couple of weeks, for instance, I added the first outbreaks to my map in Alaska last week. There had been no reporting of food industry specific cases in Alaska until last week related to the seafood industry, and there had been significant concern in the state that exactly that would happen. That once the seafood industry picked up for the summer, that cases would rise in the state, and that has been happening. Partially, it can also be linked to the spread of the virus in states generally. So, workers in food facilities are members of communities, and those communities are seeing cases rise across the country, particularly in the Midwest and the South and the Southeast. These are the new hot zones in the country for the spread of COVID, where a few months ago it would have been coastal urban centers. So I've also attributed some of that continued rise to, community spread and just the increased prevalence of the virus in these communities, excuse me. But, there are still reports from workers that they're not receiving adequate protective gear. There's still reports that employers have promised sick time off that is not being paid. So workers are forced to return to work before they're actually no longer contagious or have fully recovered. So there are still significant barriers there for workers having a healthy, safe experience in the workplace, even though, the industry has adopted more of those protective measures.
And you mentioned Tysons, and obviously those numbers that you showed us are really eye-popping. Do we know enough about the number of employees at JBS and other companies to know whether they have a disproportionately high number of workers who are getting sick? Or is it just that there are so many people who work for Tysons that explains their number? Or is there more to it than that?
That's a great question, and I've tried to figure that out. It can be very difficult to know exactly how many employees at a company work at the plant specifically. So it's been hard to distill, but certainly the fact that Tyson is the largest meat packer absolutely contributes. Another reason that Tyson's case numbers are so high is that Tyson has begun testing its workers at specific facilities. They began a process to test at some point in the last, maybe in May, they began a process to test workers at around 40 of their facilities and began releasing those figures to the public. That only represents a small fraction of the total number of Tyson facilities, and it's one-time testing, so it won't give us a sense for trends over time. But they have unearthed themselves outbreaks of several hundred people at specific facilities. So that has contributed to their case numbers also rising, and other companies like JBS and Smithfield have not participated in testing that's been made public in any event.
Your reporting also shows that the number of farm workers who have tested positive for COVID has gone up from around 1,000 in early June to now nearly 4,000. Can you talk a little bit about the conditions that are contributing to the spread of the virus among farm workers?
Yes, and that's definitely of the three sectors. The cases are rising very rapidly in that sector. We really didn't see a significant number of cases among farm workers in March, April, May, because the harvest season was not yet underway, and the number of migrant workers in the country was comparatively low to the numbers now that we are reaching the harvest season in many places. So there is, I've spoken with some folks who say, well, farm workers are outside, and isn't it, safe to be outside, or safer to be outside to slow the spread of COVID? Well, certainly that's true, though with farm workers, what some reporting has found is that the transmission of COVID often happens in their housing facilities, transportation vehicles, in the lunchroom, places where workers are still in close contact, even if while they're out in the field, they're not necessarily at as high of a risk. There's also been some indication that, farms, there have been in the past reports that farm workers have had intermittent access to bathrooms and to sanitation stations, water stations, and, that can also, of course, contribute to the spread. So there, particularly in the case of H-2A workers, so agricultural workers who come to the country on an agricultural visa, H-2A visa, the housing facilities that those workers, reside in for their duration of their time with their employer, workers can sleep, 5-6 people to a room. Of course, that's not a safe living condition if preventing the spread of COVID-19 is a primary concern. So there's been a lot of agitation and organizing among farm workers who find themselves in that situation to say employers need to provide, individual rooms, more space in transportation vehicles, and so on. Though according to reporting that I've seen, there hasn't been widespread adoption of those reforms yet. So that contributes to the continued rise that we see in that sector.
And there was some recent reporting, I think, of farmers actively discouraging farm workers from getting tested. Is that right?
There was some reporting in the state of New Jersey, which has had significant outbreaks in its blueberry sector. In case you didn't know, New Jersey has a large blueberry sector. And workers, there was a statewide effort to try to test, essentially all of the migrant workers who are arriving in the state, many of whom began the season further south in Florida, North Carolina, were migrating up the coast to New Jersey. And there was an effort to test those workers as part of statewide COVID measures. And some reporting has indicated that farmers in the state are declining to, have their workers tested. Not clear to me why that's a voluntary program. But unfortunately, the result is that it's very difficult for workers to know their level of risk, and also for the public to know, exactly what is happening on those farms. Despite that, there still have been numbers emerging, mostly through county health departments and other, official channels, that, cases are rising among workers in New Jersey. So, we're going to probably see the continued spread of that.
Great. And we only have time for a few more questions. And for folks who are just joining us, you're joining a Facebook Live presentation with Leah Douglas of the Food and Environment Reporting Network, who's been closely tracking COVID-related illnesses among food and farm workers. We've gotten a number of questions, again, about racial disparities in the food and farm sector, and whether people of color are more likely to work in the sector, more likely to get COVID. Can you tell us what we do know about that?
Sure. So absolutely, as we've seen, the national trends indicate that, people of color are contracting the virus disproportionately to white people. In the agricultural sector, people of color have always been disproportionately employed, or at least in recent memory, in food processing, meatpacking, and farm working industries. So we are continuing to see that trend. Again, like I said earlier, the CDC report that came out yesterday indicated about 90% of meatpacking workers who contracted the virus identify as people of color. At farm workers, the vast majority are Hispanic, or other identify as people of color. So that is going to be an ongoing trend. The issue of COVID-19 among food system workers is absolutely a racial equity issue. The poor conditions faced by those workers in this sector has always been a racial equity issue, because many of the conditions that workers are facing are longstanding. You know, workers have advocated for themselves, have organized themselves around access to bathrooms, access to sanitation, access to time off, access to higher pay. These are longstanding concerns. And, you know, the fact that the majority of these workers are non-white is absolutely part of that story, and a large part of the reason why these disparities are so visible right now. So, you know, I hope that one of the hopes that I have with my work is that that folks see this issue as connected to the broader racial equity conversations that we're having in our country today, that, you know, this is absolutely, you know, a disparity that has emerged because of race and can only be also addressed if we take seriously that, you know, this sector employs vulnerable workers and in many cases, low-income people of color who deserve safer workplaces.
Well, with that, I'll just thank you, Leah, for your amazing presentation and for your amazing work, keeping track of, to the extent that we know, how many food and farm workers are getting sick or even dying from COVID. And for folks who want to follow Leah's work, we've included the link to all of her amazing reporting in the comments section. And thank you, Leah, again for joining us.
Thanks so much for having me. Thanks, y'all.